of today. We are organizing this session on the occasion of World Cancer Day. 4th of February was World Cancer Day. Cancer today has become the second leading cause of death worldwide. That's the bad news. I have personally lost very close family friends, my buaji, my mother-in-law to cancer. The good news is that the survival rates are improving with the research and the awareness that is spreading. And that is one of the reasons we decided to dedicate our sessions in February, in the month of February, to spread awareness about the causes of cancer and what is it that we can do to be better prepared to deal with it. So the session today is the first one in that context, and it is being taken by Dr. Nupur Agarwal. Dr. Nupur Agarwal is a medical doctor based in London in UK, and she has been working very closely with the cancer patients in NHS hospitals for the last 5 years. She's a dentist, a gold medalist, who has transitioned into mind-body medicine in the last couple of years of her work. She's a certified mindfulness coach, a clinical hypnotherapist, and she has been working in helping patients deal with their conditions. You know, one of the things she says, which I like the most and I quote often, is that pain is inevitable, but suffering is optional. And it is this mindset, you know, that helps a lot in dealing with situations in life, when dealing with cancer, and dealing with many other chronic conditions which have become lifestyle diseases these days. So that is what the session today is about. I'll take a minute to introduce myself, as many of you are joining us for the first time. My name is Ashish Kumar, and I'm the founder of Mindful Living. I set up Mindful Living 3 years back after working in the corporate sector for more than 25 years in senior management roles, working with organizations like Tata AIG, Xerox, Future Generali, Marsh, HCL, and Dava Group. In the last 3+ years, we have conducted more than 250 sessions for employees in the leading corporates like Tata Group, IBM, Kotak Life, SDFC Life, Signify, Schneider, Airbnb, and many others, helping the employees deal with issues like stress, living, improving their health, and becoming happier and more productive at work. The session today is a part of the Mindful Living community, which we started nearly 2 years back when the COVID, at the onset of COVID in April 2020. And what was a small group of 10 friends who got together to start practicing mindfulness has grown to be a community of over 1,500 people today, where we connect every Saturday to discuss themes around application of mindfulness in our daily lives. So that's the intention of our, starting Mindful Living and the work that we are doing in Mindful Living. What I would like you to do is take a couple of seconds to pause and share your intention with us. What is your intention of joining the session today? And you could type in the chat, what is it that you're seeking? Or you could unmute yourself and speak. We'll pause to hear from you. And while we are waiting to hear from you, we really thank you for taking out time and joining us today. We really appreciate that. And we will do our best to make this worth your while. Understand the relationship between thoughts, emotions, and health better. That's very well said, Balaji, because one of the major causes of cancer and other chronic diseases is repressed emotions. It's a new line of treatment, so want to understand it. Thank you for sharing that, Madhu. Friends, please keep sharing Samir for information to know about alternate therapy for taking care of survivor. Thank you very much for sharing that. So friends, thank you for engaging with us actively. The session today is not a podcast, so we will urge you to keep your cameras on. It is also not a TV show that you can lean back and enjoy. Please keep your notepad and pen ready and take extensive notes from what Dr. Nupur is sharing. And you may have some wonderful information coming to you at the end of the session, where we will be talking about how you can learn more to apply this wonderful technique, some of the wonderful techniques that Dr. Nupur is going to talk about, how you can apply in your life and how you can benefit from it. So on that note, thank you friends for joining us today. And thank you, Dr. Nupur, for conducting such a wonderful, putting together such a wonderful program for us. Over to you.
Hello, everybody. A very warm welcome to all of you.
Hello,
So, can you hear me? Yes. Okay. Wonderful.
Yes,
so I would
Dr.
like.
Audible.
Okay. Thank you so much. So I would like to talk to you about the power of mind-body connection and also share some deep insights of my work that I've been doing in the hospitals for the last 5 years. So what is really mind-body connection? The thoughts that we have, the emotions that we have, and the beliefs that we hold all have an impact on our well-being. And this is a fact that we now are seeing manifest and play out clinically in all the patients who present us, with chronic health conditions and cancer. And we have to understand that what's going on that is so positively and powerfully, and sometimes not always positively, but perhaps deeply impacting our health and our well-being and our disease progression and our diseases inception. So from how are the diseases happening? Because as most of us, whenever we go to the doctor, we hear them say, reduce your stress levels. Your stress is causing this. There is nothing else. There is a stress is causing it. So, there are a lot of studies that are actually connecting what really is stress and what is it that's affecting our bodies. At the deepest level, we in the medical line, we don't always understand what's causing something. We do understand the progression of it. We do understand how to curtail it to some extent, but what's really at the root cause? And the mind-body medicine is actually something that's pioneering to link this in our space. And I have been working especially for cancer patients along with other chronic health conditions. I have presented my research at international conferences. My research has got published. And this is just one of those which I'm sharing here. If you can see, it's a poster of a patient who had to undergo bone marrow biopsy. And this patient had severe phobia, fear, and panic attacks to the point that she was not able to undergo bone marrow biopsy, which is a painful procedure. And she was asking for general anesthesia. Now, it's very difficult to give general anesthesia to patients because it wasn't indicated in her case. And not every patient qualifies for this also. And the nature of the therapy, of the treatment was such that it couldn't be given. So we started her on the mind-body therapy. And I did multiple sessions with her through various protocols that I have devised and follow in the field of mind-body medicine. And by the second, third, and fourth biopsy, and if you can see the small graph here, you can see the drastic reduction that started to happening. Each color is actually representing the fear, the anxiety, and the pain that she had. So each color has got these three different connotations, and these had drastically come down to the point that the patient didn't even ask for anesthesia. So that's the power of the mind-body medicine that we are talking about. And we have to understand that what are we harnessing here? We are harnessing the ability, the inherent intelligence that's there in our bodies. So we don't make our hearts beat. We don't make ourselves breathe. All of these are happening because of an intelligence that happens to operate all our bodily processes. It's very important for us to understand this, that there is an intelligence that's running the body. It's not random. It's almost like when in the middle of the night, you have a deep sleep and you just feel that you have to go to the toilet. So, that intelligence is what wakes you up. You are not peeing in the bed or on the way. Most of us have bladder control. Why? Because that intelligence wakes us up. right? So we have to understand that there is already a deep intelligence that's operating, and that is what is harnessed in the mind-body medicine to allow the body to heal, recover, and regenerate. And that's what we tap into when we say the body has a natural repair mechanism. When you cut yourself, no matter how deep the cut is, we just allow the body to rest. We just allow the body to heal. The only intention is when we have bigger issues like chronic cardiovascular conditions, strokes, diabetes, hypertension, cancer. At that time, we forget that there is this space within us that is allowing the body to heal. So this is the intention of our talk today. This is the intention to make you understand that the body itself is a very intelligent field and the body can heal. We just have to allow it to get the space into the healing, allow it the right environment and the right thoughts, beliefs, and emotions. And that's the whole journey of mind-body medicine. And there are very powerful techniques. And I would like to share with you that I have been working very intimately with head and neck cancer patients. I've been working with blood cancer patients. And especially in my work, I still remember there was a patient who had complete dry mouth. The dry mouth to the point that he couldn't eat, he couldn't speak, because we don't realize that saliva has a very important role to play in our ability to perform functions of the mouth. And because of radiotherapy in head and neck cancer treatment, he had completely lost the salivary function. And we can measure the salivary function. So when the patient was referred to me by the dietitian and the cancer oncologist, they told me that we have tried everything, and the patient is still not able to eat and speak because there's extreme dry mouth. We started doing the work. We started doing the mind-body work, and it was amazing that within 3 sessions, the patient's salivary measures drastically improved. And we have measured all of these. And what did we do? We actually allowed him to, through facilitation, to allow the body to be told what to do. So the body can listen to you. We allowed the body's inherent healing machinery to kick into place. But that had to be told and that had to be installed. And by 3rd session, his salivary measurements and his ability to eat had gone 50% high. And that's big for somebody who has been struggling even to swallow. Because if you don't have a moist oral cavity, your swallowing becomes difficult, your speech becomes difficult. So there are so many examples like that, which I will be sharing with you today through the session. And I would also like to urge you today to do a simple test with me, which is called the lemon test. Now, this is a very interesting test to experience ourselves, that our thoughts are so powerful that they can actually trigger sensations and emotions. So what I am going to ask you all to do is just close your eyes for a moment and just allow yourself to listen to my voice. That's all you need to do. And I want you to imagine that you are holding a lemon or a lime in your hands. And now I want you to slowly bring that lemon or a lime in your hand and bring it up to your nose. And I want you to just feel what you feel, smell what you smell. And now I want you to slowly start to cutting it. There's a knife next to your lemon, and you slowly start to cut into that lemon. And now I want you to bring the cut half near your nose and open your mouth and squeeze a couple of drops of this lemon in your mouth. And now open your eyes and share with me, did anybody feel anything? Was there any experience, smell, tang, taste?
Dr. Nupur, increase of saliva in my mouth.
That happened.
Yeah, same
Okay.
doctor. Even with me, I could feel the saliva in my mouth, and I just wanted to actually feel that flavor.
Yes.
That there was a strong signal by my brains to urging me to feel that pricking flavor that the first drop of lemon gives. So yeah.
Exactly. So do we understand that just a mere thought, the power of a thought, just the ability to think something can actually bring about a physiological change in the body. So what you experienced was what we call a physiological change, right? So just the ability to think something can trigger a physiological response. And this is a big realization that we have the power to trigger the release of chemicals, the neurotransmitters, hormones, and saliva. You all experience, some of us maybe experienced it to some extent, some of it was a very brief exercise. If I take you through even the depths of it, we can make it a proper 5-minute meditation. And then we have even measured the salivary releases through these meditative exercises. So do you understand how powerful our own emotions are to trigger certain things in the body? And that's, we have all experienced that. Sometimes just the very thought of a past incident, the very thought that we are thinking something of our past is actually triggering emotions. We can just well up, we can have tears in our eyes by just thinking of somebody we love, and perhaps somebody who has passed away. We think of those precious moments that we have spent with them. So this is very important when we talk about the power of mind body medicine. The ability to think, the ability to feel, and the ability to experience sensations and emotions in the body is triggered merely by a thought and a belief. And we have to understand that our bodies are a very rich source of biochemistry. Every chemical that you can eat to help with your pain management, to help with your stress, your anxiety, and to help your body to balance, all of those chemicals are actually produced in our own body. That's why we have chemicals. That we have receptors to receive these chemicals. And that is what we are harnessing through the mind-body medicine. And now we actually know that there are areas in our body where we can actually feel the emotions very strongly. And there is this study that has been done, which I will come to. But before I come to that study, I want you to understand what is your nervous system responsible for. In our nervous system, we have a branch which is called the autonomic nervous system. And this is a very powerful field, a very powerful part of your body, of your nervous system, which is responsible for your stress response or your relaxation response. Now, the parasympathetic nervous system and the sympathetic nervous system. Just to, without getting too technical, I want you to understand that when we think of, if you just imagine your ancestors, they were cave dwellers, right? We have survived and lived through caves, through normal natural conditions. And those times our threats were like a tiger, a snake, something that's going to kill us. So our survival was threatened, right? Now, stress response is what would be triggered by our amygdala. It's a part in our brain. And that would release a cascade of hormones by activating our hypothalamus, our pituitary, our adrenal glands to release cortisol, which is called the stress hormone. But this hormone is very important because it helps us to react to a life-threatening situation. We would run, we would escape, our heart needs to beat because the blood needs to be pumped to our extremities, to the bigger muscle groups. So this stress response is a very powerful stress response. But what happens is, today's time, our stressors have changed. Our triggers have changed. It's no longer a tiger waiting to eat us up, but it is our stress of managing our lives, our work, our colleagues, our bosses, finance, health. All these are the stresses which are creating a constant chronic stress response. And once we have a constant chronic stress response, what happens is we have constant release of stress hormones in the body, cortisol, epinephrine. They are being pumped to the point that our bodies feel that we are in a dire state of survival. Now, when we are in that state, nothing can change our biochemistry and we will suffer from our conditions. cardiovascular events. Inflammation goes up when we have a chronic stress response. And inflammation is one of the key reasons why people develop hypertension, diabetes, cardiovascular conditions, cancer. So you have to understand that somewhere we have not understood how our own nervous system and biology is creating our dis-ease, our stress. And the contra is to this is the relaxation response. Relaxation response is when we can trigger the parasympathetic nervous system. And the moment we do that, our body comes into a homeostasis or a balance. And positive hormones are released, endorphins, oxytocin, neurotransmitters, dopamine, serotonin. These are all well-being hormones. Now, these are key game changers in our journey to heal. And that's what we have found out in the research, all the work that I've done, all the publications that I've done. How have the patients changed in their ability to receive, recover? Tumor sizes have gone down. Patients who have been feeling, there was a patient who had become water phobic. The patient wasn't able to drink water after the chemo and radio. The patient started to drink water just on the second session right in front of me. So these are the miraculous shifts that have happened. You know, how do they happen? Because we have triggered something internally. We have understood the art of communication with our bodies. We have understood the parasympathetic nervous system activation. We have understood the key relaxation response that we can trigger. In fact, while I was doing this research, I came across that in Japan, there's actually a word which is called death by overwork. It's called karoshi. So people are actually dying because of death, because of overwork. They're dying because of the work stresses. So understand that how much can we trigger our own disease processes, right? And this is a key understanding that you all need to understand. The biggest game changer in the healing journey is to activate your parasympathetic nervous system and to set in a relaxation response. And there is a lot of research and studies that have gone into this. Now, this is a very interesting study that was done in Finland by a group of scientists that they actually mapped the areas in the body where where people who were recruited for the studies actually highlighted that emotions were stored in these areas in the body. And this is again a very key place that I want you to understand, that the emotions that we feel are actually stored in our body. There is enough evidence for us to understand this now. There are books that are written, books on trauma. So when we have something called traumatic events in our life, trauma, what war veterans go through, it's called PTSD, post-traumatic stress disorders. Trauma could be not necessarily at the war. Trauma could be somebody who has had a very difficult childhood, somebody who has had a very difficult teenage, somebody who was abused. So all of these emotions and all these energies are actually trapped in our bodies. And this is a wonderful study that talks about this. Now, why is this important for us? That's very important for us to understand. Why is this important? Because once we store these emotions, they form patterns, they become hardened in our energy field, and they trigger these cascades of biochemicals in the body. And these are what cause and aggravate the disease process. So if you have got deep emotions which have not been addressed, if you have fear, hatred, animosity, anger, if you have anger issues, then all of these is what gets stored in our body. And this is one of the key reasons which we are seeing is leading to aggravating, manifesting different kind of disease processes. To the point that when I have been working for cancer patients, I would ask them, if you can communicate with your cancer, if you could communicate with your tumor, ask it, what does it have to say to you? What are the emotions that are trapped here? And it was amazing that once they learn the art of communicating with their disease, tumors, the insights that were coming to them. Their own bodily discomfort starts to talk to them. Their pain starts to talk to them. The pain has a message in it. The pain has something to tell you. But what we do is we just douse our bodies with chemicals and medicines, and we numb ourselves. I'm not saying medicines are not good. We need to help ourselves. But we have to also understand that like everything has multiple approaches. this is also a very key area for your well-being. So when you're having a discomfort, when you're having a disease, don't just douse it with medication. Go down, understand what is it trying to tell you. What is that tumor trying to tell you? What is that pain trying to tell you? Why is the diabetes to that level? What in your life are you not able to process? What emotion is being trapped in the body? So these are the kind of questions that we asked when we are doing the work on mind-body connection. And once you start understanding the why is this so important? Because I have understood one key area in my clinical journey, that the patient, the person is as much a party to the healing than the doctor. What we have done is we think our bodies are like a car. When a car breaks down, we take it to a mechanic and we expect that the mechanic will fix our car and bring it and give it back, and we'll drive back in it. And that's exactly what we are doing to our bodies. Anything that goes wrong, we just take our bodies to the doctors and just expect them to fix it. And then we continue with our life. And there's a huge disconnect between what we feel we can impact in our healing journey, right? So it's very important to understand that our bodies are not a piece of instrument. They are a very, very vital, intelligent field of energy that we can impact through understanding what emotions are stored, through understanding what is my belief, what is my thought process. And that's what we do in Power of Mind-Body Medicine through various tools and techniques, right? So if anybody has any question at this point, I'd be very happy to take it. I'll just put in my presentation back. Any thoughts, any questions, please feel to ask.
Is parasympathetic nervous system, we can have a direct control?
Yes. We can have a huge control over the parasympathetic nervous system. We can trigger and we can influence our relaxation response. And that's what the whole understanding. So we have actually designed a workshop for you. So, but I'm also going to give you a lot of tips and techniques through this presentation today to understand how can we enhance and access this parasympathetic nervous system trigger, right?
Thank you.
Now, thank you. Anybody else has any question? All right. So there is one field which, so there are multiple fields of research right now. Is somebody saying something?
Okay. Yes, I just had a question. Does this work in case of autoimmune diseases also?
Absolutely. Thank you for that question. It works wonderfully well with autoimmune diseases and conditions, because what happens in an autoimmune condition is our own immune system gets against the body. It's almost like you have an army to protect your kingdom, and that army turns against the kingdom itself, right? So imagine your own immune system is getting triggered. So immune system has a very key role to play against the viruses, bacteria, and the things that are being attacked from the outside. In autoimmune conditions, it happens internally. So understanding what is triggering this, that something has gone against our own selves, right? So when we understand this, we can really enhance the quality of life, we can enhance the well-being, and actually see the shift in the bodily processes in autoimmune conditions. I have worked with fibromyalgia, MS, and multiple other conditions and seen huge shifts, right? In that irritable bowel syndrome, though it's not an autoimmune condition, it is one of the chronic health conditions, digestive disorders. We see huge improvements in the symptoms and in the discomfort. Understanding what psychosomatic means really. Psychosomatic, psycho is mind and soma is body. So every chronic condition, things like cancer, have a huge psychosomatic element to them, right? A field in science and biology called psychoneuroimmunology is telling us exactly this. So there is so much research that's happening in the mind-body medicine that is telling us that we are not victims, that please look at your bodies as a very intelligent, wonderful space. And epigenetics is one of the most recent studies, fields of medicine that has come up in research by one of the pioneers has been Dr. Bruce Lipton. And he has said, and he's got books that I'll be talking about later on, that we are not the victims of our genes. How many times have we heard that this hypertension runs in my family? Diabetes runs in my family. And it may run in your family, I'm not denying that, but how much are we believing that just because something runs in our family, we are going to manifest it in our body? And what we have understood through epigenetics, epi is upon something. So something which is above the genetics, that there is a field that controls, there are triggers and switches that controls whether our gene will get expressed or not. For something to happen, the gene has to switch on or switch off. So it's very important for us to understand that we can influence whether a particular gene will get expressed in my life, in my body or not. Just because I have the breast cancer gene doesn't mean that it will get expressed in my body. So what can I do to ensure that that gene doesn't get expressed? Because that's the research that Dr. Bruce Lipton told us, that the environment in which the cells are bathed is very important for something to get manifested and triggered. Genes cause the production of certain proteins, which create either wellness or illness in the body. So if we can control the environment in which the gene is, and what is the environment? The pool, the chemical pool in which all our cells are bathed, the chemicals which the blood is carrying. And how do we do that? Through our mind, through our psychosomatic influence on the body. So that's the space that we learn in the mind-body medicine. Your personality creates your personal reality. This is a very, very important space that I want all of you to understand today, that the personality that you have is creating a personal reality. If you have hypertension, if you have diabetes, if somebody in your life has been diagnosed with cancer, then really ask yourself, what am I thinking? What are my beliefs? Thoughts are the language of the brain and feelings are the language of the body. So how we think and how we feel is actually creating a state of being for ourselves, right? And that's what is so important for us to understand. There's another deep aspect of our nervous system, which is called the subconscious mind, right? Now, if you can imagine an iceberg, the part of the iceberg that's visible to us, that's our conscious mind. And that part of the iceberg that is submerged is our subconscious mind. And our subconscious mind is what's actually absorbing all the information, all the energies that, and especially in the first 7 years of our life, we are very, very prone to absorbing all the messages that are being received. But this space is active throughout our lives, right? And this is the space that we have to access when we are working with chronic health conditions. The chronic health conditions like cancer or any other condition that you have, autoimmune condition, irritable bowel syndrome, we have to understand that by communicating through our subconscious mind is controlling our autonomic nervous system. And autonomic nervous system is autonomic. Matlab, it has, if I want to pick up this cup, I can stretch my hand and pick it up. This is not autonomic, right? This is autonomic, but something that's going on in our body, which we have no influence on, like the beating of our heart, right? The breath that's moving. All these functions are being controlled by our subconscious mind. The disease progression, the disease recovery, tumors, the metastasis of the tumors, spreading of the cancer, disintegration of these cancer cells. So much we can control by communicating with that intelligence of the body, by activating our subconscious mind. And this is what we have seen again and again. By seeing the patients, how they have responded to the treatment, right? Fears, phobias, patients who have to get a head and neck cancer need to get a mask prepared. For that, patients who are claustrophobic, phobias have been removed for patients through subconscious mind reprogramming. Pain management techniques are once you can access your subconscious mind, you can be taught pain management techniques. And these once learned are for you forever, for your lifetime to access. How do we speak to our immune cells? How do we enhance and activate the PNS, parasympathetic nervous system, and speak to our immune cells so that they are not activating against the body? They're not triggering defense mechanism against our own cells and tissues. That's the space that we talk about. Another huge area of study that is being happening, and that's something that I teach in my sessions with patients, is power of visualization. And this is again a very important space that I want you to understand, that our mind doesn't know the real from the imagined. So if I ask, see, when you were asked to do the lemon test in the beginning, your mind didn't know whether the lemon is really in your hand or the lemon is being imagined. You yourself experience this all the time in your life. Just by the power of imagination, the mind gets triggered to release chemicals. So it's one of the key breakthroughs that has happened in the field of neuroscience, that our minds don't know whether something is really happening or something is being imagined. And this is the power that we access when we are working with cancer treatment. We enhance the ability of the body and the mind to heal to the extent that the body doesn't know whether it's actually receiving the treatment or the treatment has or the healing has actually already occurred. So we can trick our mind and body to believe that the healing is happening. And once we do that, once we understand the ability to do that, we can start to regress the size of the tumors. We can start to reduce the side effects, nausea, vomiting, pain. And this is actually what we are doing. So when we are seeing studies happening, I ask you to imagine the color red, or I ask you to see the color red. The same areas of the brain are getting activated. Seeing the color red, that area, the visual area, and imagining the color red. And this is so important because every part of our body has a representation in the mind. Every organ has a representation in the mind. If you think of something called the phantom limb phenomena, what does that mean? That means it is seen in people who are amputees. So you may have had a part of your body cut, but you can still feel that part of the body as if it exists. Look it up, phantom limb phenomena. What does that really mean? When the person doesn't have a part of the body, they still feel that the part of the body exists. They can still feel an itch in that part of the body. They can still feel the need to scratch that part of the body. Why does that happen? Because the physical organ is not there, but the imprint of that organ in the brain is still there. Every part of our body is represented in our brain. And this is a very, very key thing I want you to understand. And that means when we are thinking, so when I do my sessions and I ask the patient to focus on the tumor, the patient has all his attention focused on the tumor. Now, not just the actual tumor in the body, but also that part of the brain, which is responsible for processing that area of the body, gets activated. And as we discussed that the brain doesn't know the real and the imagined, we start activating the process of disintegration. Whether this is for pain, whether this is for a tumor, whether this is for your high blood pressure, for your diabetes, for your irritable bowel syndrome, or for anything, the results are amazing. There's something called peripheral neuropathy. Peripheral neuropathy is when your extremities become numb. You can't feel that part of the body. And that's a very, very common thing that we see as a side effect in blood and lymphatic cancers because of and many other cancers for the chemotherapy that's given, to the extent that a patient cannot even hold a spoon to feed themselves because they don't have the right tactile sensations. We can actually impact by going into the body and start telling it to regenerate the nerves at that end. So just the power of visualization has, when it is guided through the subconscious space and once the patients are taught, so everything that we are doing here can be learned by you and it can be used in different areas, right? So this is the space that I want you to understand. Now I want you to actually, if any of us have been diagnosed with cancer, if any of us have been diagnosed with a threatening life condition, these are certain key questions that I ask my patients, and these questions are very, very powerful questions. So if there is something I want you to really think of, if you want to take a screenshot of this, please by all means do. These are very key questions to ask. What would I be doing if this diagnosis was magically taken away from me? Now, why is this question so important? Because when we get diagnosed with something, we are fixated on the problem. We forget all other aspects of our life. That cancer takes over. That health condition takes over completely to the point that we are driven by fear and other crippling responses. But if I ask you this question, what if this diagnosis was magically taken away from you? How would you feel? And the patient starts responding. and starts thinking all the positive areas in their life that they can actually activate. Why is joy missing out of their lives? Because the diagnosis has happened. Can you think and activate those positivities, those emotions? What would my life look like? How would I feel? What does my body need in order to heal? Is there anything keeping me from my most authentic self? What do I think might lie at the root cause of my illness? And if I can drop my diagnosis and shift my focus, because these are the key areas that we have to understand, that we get so absorbed in the illness that we forget the wellness. And in mind-body medicine, the shift, the magical shift happens is when you focus on the wellness and not on the illness. And this is a big shift that can happen. Focus on what's good, focus on how you can impact, focus on living your life. And even if it is a terminal condition and you've been told, there have been so many times that we have seen miraculous results. And there is a project that is called the Project of Spontaneous Remission. And the Project of Spontaneous Remission talks about people who have got cancer and they have got into remission spontaneously, and they are a medical mystery. We don't know how that happened, but we know that once the study was done on the Project of Spontaneous Remission, people have come up with these answers to these questions, and that's how these questions got formulated, that these people focused on living life with joy and abundance, and they were not fixated on illness. I have trained with Anita Moorjani, and Anita Moorjani has been one of the key reasons why I have been working in the mind-body medicine. She is somebody who had stage 4 cancer, and she almost died from it. And she had a very strong near-death experience. And once she got back from that near-death experience, within weeks, her cancer was in remission. Within weeks, she was back, and she's been living a very healthy life. It's been over a decade now. The insights that she shares with us in her spontaneous remission is what my work is based on, because I've trained with her. What are the key reasons that we are fixating on our illness, and how can we shift from that illness into the wellness model? What can help us heal? And I am not saying that you have to, that this is anything woo-woo, or you cannot, you have any of us have to have a near-death experience to experience a magical healing. But if a person has come back with such key insights, it's really our responsibility to understand that we don't have to suffer our illness. We don't have to be subjected to that. There is so much in our power that we can do, right? So these are very key questions for you to, if there's one thing that you take back, if you don't decide to, for any reason, if you are thinking that this workshop that I'll be talking about for you is right now something you can't invest in asking yourself these questions. These themselves will lead to very powerful shifts in your healing journey. And this is something I want to talk to you about. It's a very powerful study in the field of athletics, breaking the 4-minute mile rule. Now, till 1954, in the field of athletics, in the field of the science of athletics, it was believed that nobody can run a mile in less than 4 minutes. 4 minutes was the golden minute. 4th minute was the golden minute in which a person could run 1 mile. It was impossible for the body to allow a person to run a mile in less than 4 minutes till Roger Bannister came along in the year 1954, and he broke the 4-minute mile rule. He finished a mile in 3 minutes, 59 seconds. And this was a mind-boggling discovery in the field of sports. And the day he broke the record, within weeks, people started breaking this record all over the world. And it had never happened till 1954. And I really want you to ask yourselves what happened that led to people breaking this rule once he broke the record. It was a belief that had got dismantled, a belief that was going on that this is the only way we can live, that nobody can do it. But the moment this belief was cracked, people started to break the records, and people broke his records also. Immediately in the years to come, Roger Bannister's record was also broken. So we have to understand the belief that we have that and that this is a chronic health condition. This is irreversible. Nothing can heal you. This cancer is terminal. All these are things which have been told to us, but why are we believing into them? Why can't we do our research and understand and that no, nothing is impossible? This is a belief. Why are we buying into the beliefs that are being told to us? Read about spontaneous remission projects, see my research, talk to me, and understand that once we drop our labels, we can access this deep intelligence that's telling us no, nothing is set in stone. Drop the word chronic, drop the word cancer. One of my patients was very fascinating to hear his the take on cancer. He used to say, no, I call it cancel, not cancer. He replaced the R with an L. And he said, I just say cancel. And I'm canceling everything. I'm canceling this thought that I have anything. I'm canceling this disease progression, and I'm canceling the belief and the thought that I am. And he was branded as stage 4, last stage terminal patient. Stomatis meritus. There's a patient, stomatis meritus. He's a case study that one of the initial case studies that came up. He was written off. He was told that you are terminal. You have to just find peace in your life and now live your life as this is the end of it. He went back to his hometown thinking, anyways, I've been given only a few weeks and months to live. Let me live in my hometown peacefully. And this man actually went on, started living his life to the fullest. He actually forgot that he has cancer. And he didn't outlive by months, but he's outlived by years. And when he went back to the US to ask his doctors, what happened to me? How come I was supposed to be terminal, but it's been a decade and more? The doctors he had consulted with had died. So he had outlived the people who told him that you have only few weeks. So I want you to understand that drop the beliefs that you are believing. Drop the narrative that has been told to you. Find your truth. Get onto the healing journey. Understand that your body is a miraculous piece of instrument. It's a miracle. When you study medicine, you understand just 2 cells coming together and creating this masterpiece. What goes on to create our bodies, we are no short of a miracle. So really start understanding that this miracle is a very intelligent miracle. It can heal. We don't have to surrender. That's the most important thing. We have to understand a lot more that's going on. We are resisting our own diagnosis. When we are diagnosed with something like cancer, we think that we have to fight it. And my approach is, don't fight anything in your life. Embrace it. And once you start working with me, when you start working in my workshop, you'll understand that embracing everything, accepting things, and then working towards them creates and activates the parasympathetic nervous system. It activates the relaxation response, because the body is not thinking that there is an enemy to fight. Right now, if you think that your tumor, your cancer, your diagnosis is your enemy, then what are you doing? You're triggering the stress response. You're triggering the chemicals, the cortisol, the neurotransmitters that are creating the imbalance. And how will the body heal? So we have to shift from the fear mind into a allowing space. We have to understand that nothing has to be fought. It has to only be understood, accepted, and then released very lovingly. That's the shift that we bring around in mind-body medicine. Don't resist, but allow. And start this communication with our bodies. And as I was telling you, communicating with so it's almost like, try this thing out today. When you go to bed, don't put an alarm unless you have a early morning flight to catch. Tell your body, wake me up at this time. And you will be amazed that without an alarm, you will wake up. Because this intelligence is always listening to you. But we are never speaking to our bodies. How many of us have ever even tried speaking to our bodies? Barely ever. If we have, that's great. And then I would really like to ask you, share your experience if you have done this. How do I do? We learn the art of communicating with our bodies. Communication is a skill that has to be learned. We don't even have the skill to communicate with other people. That is also taught to us in our lives. But we forget others. Right now, do we even have the art of communicating with our own bodies? That's the question to ask. That's the space I want you to all understand. And I have one of my so when I work in the hospitals, I can't take names because it goes against the confidentiality issues. But I have somebody who I worked very closely in this cancer journey. Her name is Dushi. So Dushi, I would really ask you to unmute yourself and share your experience, if you don't mind. And I hope I have not put you in a spot. So would you like to share your experience with everybody, please? Tell us, how did you feel working in the space of mind-body medicine and how it helped you?
I can't tell in words. I will cry. It was just something I can't express in words. Like when I go for my chemo, when the medicine which is going into me, I would imagine, I would think about Nupur, and that will bring a smile in me. She taught me so much what to think, how the medicine which is going into me, into my tumor in my breast. And I would just imagine that it is going smaller and smaller, and the medicine is healing me, and all my tumors and all the cells, like unwanted cells, are disappearing. I lived in an imaginative world for that 6 months. So I used to imagine this a beautiful place with beautiful trees, and my goddess. She taught me that. I was not very religious at all. And Nupur said, imagine about, if you're not religious, imagine about something like somebody or someone dear to you. So I thought, okay, let me imagine my goddess, where all my ancestors went to pray. It's just a one small temple in a village, a beautiful village. So I used to imagine my goddess, and she's healing me, and all my ancestors come and pray to her, all these things, I think, and that kept me in a very happy state. Whenever I imagine that I am all smiles, even in that very bad condition. I lost everything, my beauty. I was like charcoal color. I had this flawless skin and beautiful hair, and everyone used to say, they won't even know how old I am. They always used to say I'm so young. And I lost everything. I was like E.T. I was watching E.T. movie one day. It was on TV. When I looked at it, oh my God, I looked like E.T. That's what I felt. And I was laughing, and I'm very positive. I thought nothing can destroy me or take me away. Even a little sunshine would change my mind from dullness to happiness. It was all in my mind. I don't know what to say. Just Nupur helped me to deal with my illness. She was like someone very dear to me still, after 3 years.
I mean, thank you, Dushi. I also get tears in my eyes as you're saying this, but it's not about me. It's about the science that exists. I'm just a channel. And I want everybody to understand that and Dushi is in remission by God's grace. She's doing well. She's traveling. She was in London. She's now in India, spending time with her family. And I want you to understand, and Dushi, thank you so much. I know how difficult it is for somebody to open up and share. But, we need people like you more than people like me, because, you have lived this journey, you've gone through it. And when you understand that you can influence it, a lot of times patients tell me I'm getting injected with toxins when I'm getting chemotherapy. I said, no, you're not getting injected with toxins. Change your thinking. This is helping you. And the moment they change their thinking, it's amazing that the side effects have started to come down. We could see that the same drug on the same staging of cancer was causing lesser side effect in some people and was causing more side effects in other people. We were wondering what's happening. The way they were approaching their treatment changed. We have something called the placebo and the nocebo effect. These are the effects that I talk to and teach patients. And this is what I do when I teach my workshops. I teach patients that this in any drug trial, we have one drug, which is the therapy drug, and we have one drug, which is the sugar pill. Patients don't know what they're being administered. Doctors don't know what is being administered. Only the researcher knows. Patients who are given the sugar pill show signs of improvement. And the nocebo effect is, if you tell a patient that you will get side effects from this condition and they're getting a sugar pill, they show side effects. They'll start getting nausea, they'll start getting vomiting. The power of our beliefs, the power of our mind over our body, the power of our emotions, psychoneuroimmunology, epigenetics, psychosomatism, subconscious mind, these are the spaces which have helped Dushi. And what's helped Dushi is not me. What's helped Dushi is her allowing me to help her. We have to allow the people, we have to be open enough to trust, believe, and receive. And that's what my intention is only to be bringing. I've been working in the West for 7 years. My intention is to bring this in now to India and to set up and help and set up support groups, set up the places where we can do this. And that's the reason I'm so grateful to Dushi for actually sharing this. I'm going back to the slides, sharing the presentation once again. I hope you can all see it. So I would really urge you to understand, write a self-prescription for yourself. This is very powerful. Write a prescription, believe it's possible, get the right support, listen to your body and your intuition, diagnose the root cause of your illness, write a prescription for yourself, and surrender attachment to the outcome. These are some of my key areas in which I want you to understand you can impact your healing. What we do, we go to the doctor, we have a white coat syndrome. And I'm not saying don't go to your doctor. I'm not saying don't believe in a doctor. I am myself a clinical medical doctor, right? But they are not the final ultimate truth. You have to take charge of your health. You have to take charge of your wellness. So create your self-prescription. If there's nothing that you take away from this talk, please take this away. This is the most important thing that I want you to understand. I want you to understand that when you have pain, and I want you to today do a little short exercise with me. How do you communicate with the body? You know, how do you communicate with the body? And Ashish, can you please tell me how much time do we have left?
So it's 5 o'clock. We can check with people in case they're interested in staying on for another couple of minutes.
Yeah, okay. So I hope everybody has, I will probably wait till the end and do the a little exercise. Before that, I want to take you something very important, which I don't want you to miss. So please stay on, and I respect everybody's times. And so I'll make sure that we are ending at the right time. This is a screenshot of this. It's very important. And I'll request Ashmita to post my number in the chat. And if any of you ever want to discuss this at a deeper level, I'm making myself available. Please ask me, what does this mean? Please contact me, because one of the key things here is get the right support. And I am not saying I'll be the answer to all your questions, but I can guide you in the direction that you need to go, to find the people that you need to find. I can ask you, okay, you have something with peripheral neuropathy, try this with me, and try getting a reflexologist. Try this support. There is so much out there that we don't even know right now, right? So I really want you to understand that. And before I go on and talk to you about this workshop, so we have actually designed a program and a workshop on harnessing this power of mind-body connection to influence your health and healing. Whether you have cancer, whether you have chronic health conditions, or whether you have autoimmune conditions, anything that you have, understand that this program, this workshop is an aggregator of 7 years of my clinical work. It's an aggregator of my research. It's an aggregator of all the patients who have got back into remissions, back into their work, back living lives with turnarounds. And that's what's being presented to you. So it's a program with very tangible results. Pain medications have gone down. If you see my research, we can see how, and we have something called the opioid crisis in the world. People are addicted to pain medications, and that brings about a totally different problem area in their life. So understand, how can we impact our own well-being? And nothing that you will ever do with me will be without the consent of your physician. So I will never say reduce your pain meds. I will only say, see how you're feeling, get back to your doctor, consult with them, and then slowly start tapering your medication. So it's a very scientific approach that we have. So these are some of the program aims and the workshop aims that we have seen, I have seen in my work, and these are the aims that we are trying to convey through the workshop. Ability to communicate with the body, reprogramming the subconscious mind, ways of pain management, understanding the body, somatosensory experiencing. Our body can store emotions, our body can store memories and thoughts. How can we tap into the intelligence of the body to release all of this? That's the space in which we are going to be working on. And who is the person? Who's the person that will just help this? This is not only for somebody who is going through a diagnosis. This is also for patients, the carers of the patients. A lot of times our carers, the people who are taking care, get sidelined, but they once learn these powerful techniques, they can really help, right? This program is also people who find themselves who are very emotionally and mentally vulnerable. They feel they're the victims of life and their situation and circumstances. People who are empaths, they absorb emotions. So we really understand how to maneuver and change that landscape for ourselves. And this is the course content: science of mind-body connection, pain management, somatic sensing, parasympathetic nerve system activation, deep tissue healing, cellular regeneration, quantum field access, mind-body coherence through matrix reprinting and visualizations. And I want you to understand that this is a very unique program. This is something which I have done over 7 and 10 sessions with each patient in 7 years. Each patient that I have worked with in the hospital. And having worked, having seen the changes, having seen and having redefined the content over 7 years, this is what has come. This is not something that you will find anywhere that you can just go online and buy. This is a result of a lot of hard sweat, blood, and tears, not only mine, but all the patients that I've worked with. I don't take the credit of this because this has actually come about because of people like Dushi, because of their openness, their coming along with this research pilot that I have published, that we have come up with these powerful techniques. And also my teachers, Anita Murjani, Dr. Joe Dispenza, Bruce Lipton, and all my mind-body medicine professors. It's the hard work of a lot of people that this bespoke program has come about. So really understand that this is something which is going to be of immense power. And this is being offered at, I would say, a very, very reasonable price. We are doing 2 sessions over 2 Sundays, over 2 hours, 13th and 20th. There'll be a third bonus session. And along with third bonus session, I have an intention of setting up a support group. We don't have support groups in India, and support groups are magical. When I've been working in West, we have support group for breast cancer patients, we have support groups for autoimmune, we have support groups for every chronic health condition. So once you get onto this program, you're going to be in a support group where we are going to be constantly exchanging beneficial information. Just by talking with like-minded people, you get so much, benefit. When you hear, I am not the only one who's suffering in this space. This person is doing, but they are not suffering. They have found ways of helping. We found support groups where we learn from each other. You guys will learn from each other, right? I will just be a facilitator. So this is what will happen. And this is the fee. It is 3,499. And I'm going to request Ashish to take over and just talk a little bit about the payment and everything with everybody. And I'm going to leave it at this slide. And if anybody has any questions, please go ahead.
Sure. Maybe Ashmita, yeah, you can put it up here. Guys, you can take a screenshot of this and you can join the program. You have 24 hours window to join the program. There is an early bird offer. We are offering 500 rupees off on this. So 2,999 is the price if you join the program till 5 p.m. tomorrow. And after that, it goes to the original price of 3,499. And the program, as Dr. Nupur has shared, starts on 13th and is over 2 weekends, 13th and 20th. It's very, 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 very powerful program, as you can see. And I don't know what to say. This is amazing. And we will be also happy to hear from you. What are your thoughts? What are your takeaways? Because that is what is going to help you apply this knowledge. It's 2,999. Yeah, Nupur, you want to talk about it, the benefits to the people from joining?
Yeah, I mean, so this is a very powerful statement that came as a feedback from one of the patients. This is not what I have written. This is, so I have a lot of testimonials. If you want to go on my website, mindbasedtherapy.com, you'll see a lot of feedback. You'll see a lot of testimonials, but a lot of it I can't reveal because in NHS hospital, everything is very confidential. We can't release anything from the patients. But what one of the patients actually said in a press conference, which was conducted here, was once you learn the power of self-regulating and positively influencing the disease process, it's a lifelong skill that will greatly enhance the quality of your life. So this was not my statement. This was somebody who received this. So that's what I want you to understand, that what you are, see, everything in life cannot be measured by money, right? That's one thing I want you to understand. If you're going to have that kind of a mindset, then I would say change it for your own well-being. Because once you understand the skills, it's like when you learn how to bike, you can bike in desert, you can bike on mountaintops, you can bike through the snow. It's a skill that's learned. Everything that I'm going to be teaching you in this course is a skill that you learn. And today you will use it perhaps for your hypertension, but tomorrow maybe you have a toothache and you're waiting at the dentist and you're petrified of needles. You can use the same technique at the dental chair. My patients have used these techniques at dialysis. Once they learn how to do that, they use it for pain management. And everything that you learn is tangible. Pain reduction starts to happen, right? Pain starts to reduce, and you will tell me that now my pain has come down. I can't go in your body and decide for you. What I know is that we have measured these things clinically, so they work. We have measured pain, we have measured salivary productions, we have measured cortisol levels. So everything the body brings down, right? But the ultimate indicator is you. And these techniques, as I said, once learned are for you. Once you know how to understand and activate your parasympathetic nervous system, it's forever. It's not just for that particular thing, it's forever. So this is something you have to understand.
Will this help for unvaccinated COVID patients? I mean, will this help?
So unvaccinated COVID patients, you have to understand that I always tell my my patients and my clients, the most important ingredient in your illness or your wellness is your fear. If you get vaccinated, but you're so fearful, you can just contract it and have a very severe condition. If you're not vaccinated, but you have no fear, you may still get the virus, but you will come through it, right? So understand what is the energy behind your intention. If it is fear, it's already crippling you to the point that your body is already buckled under. So the intention behind your decision is very important. Whatever you decide, I am not the one who can tell you take the injection or don't take the injection, but I can tell you don't be in fear, because fear will create more difficulty than anything. And fear is a very powerful, you get fearful when you get diagnosed, you get fearful when you have chemo, you have fear when you're taking insulin for diabetes. Fear is a huge elephant in the room that nobody addresses in the clinical setup. That's what we work on. Fear psychosis. How do we address fear? We don't push it under the carpet. We don't ignore it. We face it, we allow it, we feel it, we love it, and we release it. Fully feeling what you're feeling is very healing, right? But we have not been taught how to feel fear. We don't know how to feel emotions, anger. So understand that this is what we are doing.
One last question, that emotions photograph which you have shown, those 14 emotions photographs, those are what colors for what? Chemicals? What are those colors?
So those colors were the areas in the body where the patient, so when you go into somatic sensory, and this is going to be explained very deeply in the workshop, we feel the emotions in certain parts of the body, right? And this was a collective chart that patients across the spectrum, across ethnicities, age, and different conditions had this mapped almost the same areas in the body where they felt those emotions. And this was a bodily map of how they mapped the fear in the body. Where do they feel the fear? Where do they feel the happiness? Where do they feel anger? Where do they feel guilt? And once they could map those fears, we actually correlated, and there are studies that have done that patients who have a certain condition in that organ are very predisposed to certain emotional states. Those are the patients who are very, very fearful, very angry. So, that study actually led on to further studies. But that was the patients mapping where they felt the emotions in the body. We usually don't even think that we can feel emotions in the body, right? So that was one study. And then works of people like Louise Hay, Anita Moorjani, Dr. Joe Dispenza, Dr. David R. Hamilton, Bruce Lipton. I mean, these are the resources that I would really urge you to think of and really reflect on, because these are the people who are pioneers. Louise Hay, I have forgotten to mention in this, but the work of Louise Hay, she had cervical cancer. She was told that it's terminal. She turned it around. She lived in the ripe age of 80s, if not more, right? So go back, look at this. We are starting the workshop only from 13th of February, as Ashish mentioned. You have the whole week to think about this. And not just you, please share this talk with people who you feel may benefit from it. And if somebody can really, if somebody cannot even afford 2,099 and they really feel they want to do this workshop and they would benefit from it, please reach out to Ashish. Our intention is to empower and equip people, right? If you can't afford it, but you're still interested in it, please reach out to us. We would hate that anybody misses out on this just because for the lack of funds or resources, right? So the benefits are immense, but you need to decide whether you want to continue living in a fear paradigm, illness mode, or you want to shift into a wellness mode. I think that's the only thing I have to share with everybody, guys. And on that note, I'll hand it back to Ashish. Thank you.
Thank you, Nupur. Maybe you can stop sharing the slide so that we can look at everyone. And thank you for an awesome session, Dr. Nupur. And I would like to hear from everyone, what are your takeaways? There are many, many things Dr. Nupur spoke about. Would be happy to hear what are your takeaways. Is this just knowledge that you're happy with? People say knowledge is power, but I think that is bullshit. Application of knowledge is power. So once you start applying the questions that Dr. Nupur has talked about, that's when the transformation starts happening. And Dr. Nupur was talking about the intelligence in our body. And when we get conceived, we are only one cell, which is zygote, and in that cell, that keeps multiplying, and then our body of 50 trillion cells gets formed. So that is the kind of intelligence that is there in our body, and which we can tap into for many, many benefits. Not only the ones Dr. Nupur spoke about, those benefits are in the context of the workshop, but once you learn how to communicate with your body, to communicate with your cells, the benefits, don't just remain to managing your health. They, spill over into all areas of your life. So it's a very powerful program, and I would urge each one of you to consider joining it. And while, we will also like to have your feedback. We will just sharing a feedback form while you are sharing your thinking of sharing your takeaways. Please fill out the feedback form. It will take you 30 seconds to fill out. Your feedback is very important for us. And once you have filled out the feedback form, please type FD in the chat box so that you have submitted the feedback. And while you're filling out the feedback form, I'll also like to share that we have sessions every Saturday. And this month, as I mentioned earlier, is dedicated to cancer. And the next session is by Dr. Shalu, who is from National Cancer Institute, National Institute of Health, USA. And she's going to be talking about the causes of cancer, and what is it that we can do to prevent, why cancer is prevailing after so many years, why there are no permanent cures to cancer yet. There are many, many interesting things that we're going to talk about. So in case you would like to know about these sessions that we conduct every Saturday, please join our community, the mindfulness WhatsApp community, mindful living WhatsApp community. That the link has been shared in the chat. So please fill out the feedback form, join the community, stay connected, stay healthy, stay happy. Thank you, Abhishek. And we'll be
somebody asked if anybody would, if you join the program, would you get recordings? So yes, we will be doing recordings, the program, and we will also be giving you in between the sessions some recorded content. So for the people who are...
Hello?
Yes,
Hello?
I think somebody was trying to speak. But yeah, yes, you will get recordings. Yeah.
Hello?
Yes, please.
Yeah, this is Puneet. Hi, Nupur. Yeah,
Hello, Puneet.
yeah, I have a question actually. My father is suffering from lung cancer.
Okay.
So he's undergoing chemo now. I can take this course, workshop, but he don't understand English or Hindi.
So you can
There's no
learn it,
reason,
Puneet, and you
only
can
like
be a
speaking it.
facilitator for him.
Yes.
So yeah, so you can learn it. I have a lot of people here who learn the program. Even here, a lot of people don't speak English, but they still, their carers learn it, and then they can deliver it to them in their language. In fact, that will be best. I always encourage people to take up in their own language. So that, yes, you can definitely do this.
Okay, thank you, ma'am. Because after reading this book, like Dying to Be Me, from Anita Murjan, I was searching like, while reading, I felt like this is very good one, but I don't know how to implement that. So
yes, exactly.
feel
And I
this.
have, yeah, you're absolutely right. And I'm glad you've read this book by Anita Murjani. I have trained with Anita Murjani, and a lot of her insights and a lot of her techniques are integrated in this program. And she's a person who had complete remission from cancer, and as I said, stage 4 cancer. So that's exactly the point. You may know it works, but how do we implement? Like Dushi was saying, I think Dushi must have taken close to 10 private sessions with me. And we can't even add up to the cost of what that must have come up to in pounds. So, Dushi, you have, haven't you? It's been so many sessions that you have taken for your wellness. So I'm sure this is something that she must be thinking, this is...
Yes, I took a lot of sessions. I wanted it.
Yeah.
Even if Nupur says it's enough, I would say no.
Mm.
Even after a long time, I had one recently about fear, to take away that fear of getting cancer again. It was wonderful. From
In
feeling
fact,
7,
yeah,
after the session, it was like 1,
yeah.
when I rated my fear. Yes.
And we rate and record fear at every stage. And a lot of patients who are under remission, like Dushi was saying, have this thinking, what if it relapses? What if it recurs? And that's one of the biggest fears with cancer. What if I have a relapse? And that is, again, a space that we talk about. What is remission? It is reliving your mission. So if somebody says I'm in remission, it's actually like reliving your mission, right? You have to understand this. So thanks for sharing the fear factor in this space of remission. That's very something that is, again, that really cripples people a lot. So that's something we talk about and deal with very beautifully. As I remember Dushi was saying, I cannot listen to any TV program which talks about cancer. I get fearful.
Even a picture of a hospital, in the hospital gown, I would just change it immediately. So it's all gone. It went away in one session. It was very surprising for me,
Yeah. It's the power of your subconscious mind, reprogramming it is the most powerful thing. Thank you for sharing that. Anybody has any questions, please free ask questions, because, that's why we are here to answer your questions. Yeah. Hi, Parakram.
Hi, doctor. So, doctor, I just wanted to ask, you said that 0 to 7 years, there's like our subconscious mind, our beliefs get cemented, and, we have our subconscious beliefs, thoughts, all of that at a place. So I don't have anything as such, but vis-a-vis illness or something, but I want to work on my subconscious mind and my beliefs and thoughts. So does it help in the larger scheme of things, like apart from diseases?
Absolutely, Parakram. It helps. By the way, you have a very nice name. So you are sounding like somebody who's also very proactive about and taking that step of looking for their well-being. I do a lot of sessions for teenagers to let everybody know. I work here for teenagers.
Right.
And these techniques and tools, once learned by teenagers, it's so powerful that it helps them in their performance, whether it's performance at school, whether it's performance at studies, sports performance, and also in finding, realizing what area of life do they want to go in. Because when you're at that age of 16 and 17, you're looking for directions. A lot of us don't know
Right.
what we want to do.
Right.
So once you understand the subconscious mind space and you understand the processes of how do you communicate with your subconscious mind, how do you release these sabotaging beliefs and behaviors and limitations that are holding you back, you can go really forward. Because you learn the art of visualization, you learn the art of manifestation. What are we doing? We are positively manifesting a desired state, whether it is of illness, wellness, or whether it is of achievement. They're all same vibration. We understand the vibrational game. We understand the reprogramming of subconscious mind, right? Whatever we focus on grows in our life. Wherever attention flows, energy goes, right? So we understand how do we channelize our energies in a way that we can live a very, very highly evolved, effective life, right? So that's the intention for me.
Thank you so much. Thank you.
My pleasure. My pleasure.
Thank you.
Anybody else has any questions?
Hello, Nupur, this is Sushma.
Hello. Hello, Sushma.
Not recently, 2 years, since 2 years, I'm suffering with, a doctor's uterus.
Sorry, I didn't hear what of uterus. Okay, your voice is breaking, Sushma. Can you just yeah.
Is it 1 second? Can you hear me now?
Yes, yes.
Your doctors are saying I have fibroid in my uterus.
Okay.
Then fibroid, they can take it out, but I forgot the name, but some kind of tumor which they cannot remove.
Yes.
And then I have what do you call this, disc bulge in my lower back.
Okay.
Surprisingly, I'm a very healthy person, but I think like after going through the sessions, I'm just analyzing my life. Some personal, one incident happened, which like, I came out of the situation, but after that, we started, like my husband and myself started diagnosing with all these, kind of diseases. But before that, I never had a back pain or anything related to my, periods. Also, I never had any issues. But since last 2 years, like, my husband diagnosed with, diabetes, and myself into a lot of issues like skin allergy. I started having a lot of skin issues, thyroid, and very severe thing which we are suffering is, I am suffering is the lower back pain and fibroid in my uterus.
Okay. Okay. So, Sushma, thanks for sharing that. And in terms of talking about the spine, I'll tell you first. You said you have a little bit of a dislocation there. Please check out the work of Dr. Joe Dispenza. He had multiple fractures, right, of his spine, and he repaired all the fractures of his spine through what I'm sharing. Subconscious mind reprogramming and power of visualization, and by allowing and coming into the zone. So the entire spine was reconstructed within weeks just by these techniques. So please understand what I'm saying, the power of it, right? And then Sushma, all the fibroids and everything that you have had, I work a lot with these as well. And once you understand the ability to deal with it, understand the ability of the emotions and the healing journey, and how you can visualize and impact the reduction of the fibroids and dissolution of fibroids, right? So I have seen, I myself had polycystic ovaries. I had lots of cysts, and I have worked on my own self, and I have no cysts anymore, right? So these techniques are very powerful. I am not saying that there'll be a complete resolution, though there can be for somebody who's completely open. I will give my 200%, but you have to meet me halfway, right? Because it is going to be a collaboration. The more open you are, the more you will receive and the more body will release. It's about releasing, regenerating, and recovering. But from what energy? Not from a fear energy, from a different energy. So absolutely, you can be helped in many ways.
Dr. Nupur, there is a question from Radha saying that will she need personal sessions in addition to this workshop?
I don't think so. I mean, we are doing 3 sessions. We are doing 2 sessions and then we are doing another bonus session. And in between sessions, there'll be a lot of support given, and my intention is to create a community where we can be supporting you will be supporting each other. I'll step away after a point, but it's a community that'll be the support. I am always there. If you want a personal one-to-one session with me, take it. But if you don't, the kind of things that we have put up in the program, there are such powerful techniques that you will learn that I don't think once you have understood them, you will not need me. And I can't multiply myself in so many places. I hope you don't need me. My intention would be that you attend those 3 sessions with full attention, see the recordings will be given to you, and you become the master healer. You are the healer. My intention is that we have to understand we all are healers. Once you learn the techniques, you take the power back in your hands. So that's what we do.
Anyone has any other questions or comments? I think there's another one which is about getting back to work and dealing with the social stigma of having had cancer and returning to work. Any comments on that, Dr. Nupur? How does one handle with emotions associated with social stigma when you're returning to work?
Yes, so I have worked with a lot of patients who didn't think that they will go back to work, right? And because they were also understand that there is a huge burden of depression and stress and anxiety that comes with these diagnoses. We are not just dealing with the body, we are dealing with an emotional and a mental state of a person. When people have breast cancer, they also get mastectomy done. They get their breasts removed. So the body dysmorphia, the inability to go back into the world as who I am, because I feel a part of me is missing. We work with all of that. Once we are so empowered and once we are in full confidence, the people around us will be actually pro you rather than becoming against you. But the moment we clamp down and we are feeling that, oh my God, I'm a victim, then that's the energy that we emit out, and that's the way people will perceive us. If people see you that you have emerged out of some crisis with so much valor and you're a victor, then people will ask you, what did you do? How did you overcome? You become an inspiration. People welcome you back to work and people ask you to give talks. Some of my patients are now giving talks at work of how do they deal with their journey of cancel. They don't call it cancer, they call it cancel. So they are the ones who are pioneering change. And each one of us is that change once we first embody it in us. Right? So there'll be so much that you will get out of the course that I can't even and this is because these are patients who have gone back. To a patient of mine didn't even think he'll come back. He had such severe peripheral neuropathy that he couldn't stand. And after 6 months, he was back he was a construction worker. He was back at the manager. He used to manage construction sites. He was back at the construction sites. That's the power of it. One of my patients was a person who used to have these hose pipes in London. You have these very high pressure hose pipes to clear away, a debris from the walls and graffiti. And we use the same pressure technique in his mind to clear away his fear. And he was back working in no time. As Dushi said, it took 1 session for her to stop getting into the fear mode. And fear mode is what triggers our stress response, right? So learn it, own it, and spread it. And once you spread it, you will be the one who will be giving these talks, not me. That's my intention.
Thank you, Dr. Nupur, for that. And thank you for that query. There's another one that we have. First of all, I would like to welcome Sushma to the workshop. She is confirmed her joining the workshop. Thank you, Sushma. We welcome you. And there's another query from one of the participants that where are these sessions going to be conducted? These sessions are going to be on Zoom, friends, like this one. So all you need is internet and a Zoom account to log in. You don't even need a Zoom account to log in. We will share the login details and you can join. There is another question in the chat about having some issues with Google Pay. Fair enough, we have made a note of that and we will share our bank account details with you and you can remit the fees in the bank account. They're already there. So the bank account details have been shared. Thank you.
Hi, Nupur.
Yes.
Hi,
Yes,
Abhishek.
Yeah.
Hi, Abhishek here from India.
Hi.
Thank you so much for a fantastic session today. It was really, really, it was penetrating. It was quite absorbing, and it was, we can connect with what you're doing. So I just want to know that what has been, you are a doctor of medicine yourself, and what has been your motivation of doing this, the cause which you are into?
Yes. Thank you, Abhishek, for that question. I was working as an oral cancer specialist in India, and I had two of my patients slip into near-death experience. They were coming back from anesthesia, and they reported something which was something I had heard about, but that was profound. And they actually told me things which they shouldn't have heard. They were in the OT. They shouldn't have known what was happening in our coffee room. They shouldn't have known the conversation that we were having. One patient reported this, another patient saw his great grandmother, and these patients told me something which I was shocked beyond wits, because a lot of doctors sign off NDEs by saying that this is because of the chemical combination of drugs that makes you hallucinate. I am very open to this aspect, which we call which people call paranormal. It's not paranormal for me. It's as normal as you and me in form. And then my patient came back and told me, and I asked them, okay, so what? They changed after that experience. They were so positive. They were so receptive. I said, what happened? They said, I know I'm not just this body. I know I'm much more than this body. And I know I have been blessed. I saw myself doing that. One of the patients said, I saw myself scuba diving. And I was like, really? He said, yeah. And these patients, I was very young doctor at that time. I was as excited as they were. Okay. So these were two people who changed my thinking. And then I started observing that same diagnosis, same prognosis, different patients responding differently, and wonder what happens. Why is stage 4 cancer prognosis terminal? One patient outlives the other. It was all down to their mental makeup. It was all down to their openness. It was all down to their that missing piece of the puzzle that I couldn't point that it is because of this medicine or the surgery that we did. It was not because of them, right? So I got thinking, what is it that needs to be delivered, and how differently can I think, and what can I do for this patient that is beyond the mind-body complex? There has to be, beyond the medical and surgical paradigm, beyond the illness paradigm, because our intention was focused on illness. Stage 2, stage 3, stage 4, this chemical, that chemical. No, but there was something beyond that was helping these patients. Their attitude, their openness, their fearlessness, their ability to trust a power above them that's healing them, not me, not my colleague. So, I got into the whole field of mind-body medicine, and now I only practice complementary medicine. I don't practice medicine anymore. This is my passion, and this is my work. It is inspired by my patients. I have no credit to take. Thank you, Abhishek.
Thank you, Nupur. All the best to you.
Thank you very
We would
much.
allow to be your support system here in India.
Well, you will support me by spreading this information. So, tell people that they don't have to be fearful. They don't have to be victims. Please take charge of your healing journey. Gift this workshop to somebody you know will benefit from if they can't afford it. Reach out to us if they can't afford it. I am ready to give it, I'll say even free. You want it, you learn it, please take it. And then spread it. It's not about anything but spreading this power. You have the power, so please take it. That's the importance of this.
Thank you, Nupur.
Thank you, Dr. Abhishek, for that question. You are a part of the Mindful Living community, so we'll be sharing the recording of this session tomorrow. I request everybody to share this with your loved ones so that they get to know about this workshop and then they can benefit from it. I also welcome everyone who has joined the Mindful Living WhatsApp community. Thank you for joining us. Those of you who are yet to join, please click on the link in the chat and join our community to stay updated on the awesome sessions we do every Saturday. The following Saturday is by Dr. Shalu, and after that, we are having a session on forgiveness. Earlier in the session, I spoke about repressed emotion, and forgiveness is a very powerful tool in releasing those emotions. So we have a session on forgiveness coming up. And the last session for February will be by Jayashree Kannan, who has beaten cancer by using plant-based whole food diet. So we have some awesome sessions coming up. Please stay tuned with us. Please be a part of the community. Give us your feedback in case you have not. I understand it is the session has proceeded much beyond the scheduled time, and really appreciate your staying with us. We will bring the session to a close now, but we'll be happy to stay on in case you have any questions. So we'll be here to answer any questions that you may have. But for those who would like to leave, thank you very much for joining us. Really appreciate your taking out the time and joining us this weekend. Thank you. Have a wonderful weekend.
Thank you. Thank you so much for sticking on, everybody. Really appreciate it. Thank you.
Thank you.